Healthcare-associated infections, HAIs, are infections that occur while receiving healthcare. Patients with medical devices, central lines, urinary catheters, ventilators, or who undergo surgical procedures are at risk of acquiring HAIs. HAIs continue to be a tremendous issue today. However, most HAIs are preventable. The prevention and management of HAIs has advanced greatly over the last decade due to legislative, regulatory, and organizational incentives. However, these changes have not resolved the gap between evidence-based and clinical practice, particularly in healthcare workers' behavioral change. Let's dig into the video to see 7 strategies to prevent healthcare-associated infections. Hand hygiene. Proper hand hygiene is the most important, simplest, and least expensive means of reducing the prevalence of HAIs and the spread of antimicrobial resistance, AMR. Cleaning hands, healthcare workers can prevent the spread of microorganisms, including those that are resistant to antibiotics and are becoming difficult, if not impossible, to treat. The 5 moments for hand hygiene approach defines the key moments when healthcare workers should perform hand hygiene. Before touching a patient, before clean, aseptic procedures, after body fluid exposure, risk, after touching a patient, and after touching patient surroundings. Despite acknowledgement of the critically important role of hand hygiene in reducing the transmission of pathogenic microorganisms, overall compliance with hand hygiene is less than optimal in many healthcare settings worldwide. Environmental hygiene. Environmental hygiene is a fundamental principle of infection prevention in healthcare settings. Contaminated hospital surfaces play an important role in the transmission of microorganisms, including Clostridium difficile, and multidrug-resistant organisms such as methicillin-resistant Staphylococcus aureus, MRSA, and vancomycin-resistant Enterococci, VRE. Therefore, appropriate hygiene of surfaces and equipment which patients and healthcare personnel touch is necessary to reduce exposure. Healthcare settings are complex realities within which there are many critical points. Microbial contamination can result from the same in patients, relatives, and healthcare workers. The role of environmental hygiene is to reduce the number of infectious agents that may be present on surfaces and minimize the risk of transfer of microorganisms from one person, object to another, thereby reducing the risk of cross-infection. Screening and cohorting patients. Early detection of multi-drug-resistant organisms is an important component of any infection control program. There is good evidence that active screening of preoperative patients for MRSA with decolonization of carriers results in reductions in postoperative infections caused by MRSA. Surveillance cultures for carbapenem-resistant Enterobacteria C, CRE, have been advocated in a number of reports and recommendations as part of an overall strategy to combat it. Isolation or cohorting of infected patients is a cornerstone of infection prevention and control. Its purpose is to prevent the transmission of microorganisms from infected or colonized patients to other patients, hospital visitors, and healthcare workers who may subsequently transmit them to other patients or become infected or colonized themselves. Isolating a patient with highly resistant bacteria is beneficial in stopping patient-to-patient spread. Isolation measures should be an integral part of any infection prevention and control program. However, they are often not applied consistently and rigorously because they are expensive, time-consuming, and often uncomfortable for patients. Surveillance. It is widely acknowledged that surveillance systems allow the evaluation of the local burden of HAIs and AMR and contribute to the early detection of HAIs, including the identification of clusters and outbreaks. Surveillance systems for HAIs are an essential component of both national and facility infection prevention and control programs. National surveillance systems should be integral to a public health system. Antibiotic stewardship. Optimal infection control programs have been identified as important components of any comprehensive strategy for the control of AMR, primarily through limiting transmission of resistant organisms among patients. The successful containment of AMR in acute care facilities, however, also requires an appropriate antibiotic use. Antibiotic stewardship programs, ASPs, can help reduce antibiotic exposure, lower rates of Clostridium difficile infections, and minimize healthcare costs. Additionally, ASPs can contribute to the prevention of surgical site infections via the optimized use of surgical antibiotic prophylaxis. Following guidelines. Keeping abreast of the latest findings regarding the spread of infections and strategies for prevention is essential for a successful infection prevention program. While many infection control interventions focus on reducing the transmission of organisms, it is as important to identify measures to reduce the risk of infection. Patient safety. Patient safety is described the absence of preventable harm to a patient during the process of healthcare and reduction of risk of unnecessary harm associated with healthcare to an acceptable minimum. Improving patient safety in today's hospitals worldwide requires a systematic approach to combating healthcare-associated infections, HAIs, and antimicrobial resistance, AMR. The two go hand in hand. The occurrence of HAIs such as central line associated bloodstream infections, catheter associated urinary tract infections, surgical site infections, hospital acquired ventilator associated pneumonia, and C. Difficile infection continues to escalate at an alarming rate. These infections develop during the course of healthcare treatment and result in significant patient illnesses and deaths, morbidity, and mortality. Prolong the duration of hospital stays and necessitate additional diagnostic and therapeutic interventions which generate added costs to those already incurred by the patient's underlying disease. In this video, we discussed about 7 strategies to prevent healthcare-associated infections. If you got this video helpful, please give a thumbs up to the video. Don't forget to share this with your friends. Subscribe the channel for more important videos like this. Thanks for watching.